Okay, welcome to the stream. We are starting our second surgery for the day at Duke Spine Institute. Again, a cervical disc problem. And this patient, you can see we are at 2, 3, 4, 5, 6, the mid body of 6. So I couldn't get to 6-7, which is the disc we're fixing, so I went down to 6. And I'm actually going to move. We're in the midline, which is nice. Give us an AP. Take the guide wire out.
Yeah.
We're actually in the midline at 6, the body of 6. We need to move down about a centimeter. You guys see that? Show us the midline. Midline is there. You have the spinous processes. Show us the endotracheal tube. Show us the, nope. The endotracheal tube is a straight line, and the braided one is the esophageal temperature probe. And then those squiggly lines on the right is the Raytec. All right, let's go back to a lateral. I need everybody in position. We're going to have to pull. Give me the shoulder pull, and let's try to make it down to the disc. So the problem is his shoulders are very broad and his neck is short, unfortunately. That has created an anatomical issue for us in terms of trying to get to the disc. Plus, you could see the disc. I need a little more south. Oh, there it is. I felt it. Shot? Yeah, I'm on the disc itself. I need an AP now. Stay where you are, Luis. Do not move. So we're trying to get to 6-7. That's good. We're in the middle. Back to a lateral. Take that. Mallet. All right, so I need a little bit better view, guys. Just the slightest bit better. Give me a little bit better. All right, so that's why we're right on the edge. Take this. I need to go a little bit further south. Shot. That is better. Let's get an AP. Almost done. Stay with me, team. Oh, it just slipped back. Stay with me. Well, let's see where we're in the middle first. Shot. I want to make sure we're still in the middle. We are. A little bit to the middle. Wait. Shot. I just moved a little more to the middle. Lateral. Again, I'm doing this with the tip of the dilator pressed against the... it just slipped again. Pressed against the front of the spine. There's a giant bone spur here, which is making it extremely difficult. I need to see further south. That looks really good. One more AP. Stay with me. We're almost done, guys. As long as we're in the middle here, we're good. Quick AP. Quick. Now. Don't waste time. Shot. That's fine. Let's go back to a lateral. Take this. I feel disc. It should be the disc right there. I just have to change my angle of attack. Shot. That is bone. I need to pull back a little bit. Shot. Yeah, that is disc. Shot. So his give me an AP. Take this. Give me that. Shot. That's really good. Back to a lateral. Relax for a minute. All right. Guys, I didn't see anything move when you guys relax. I just don't know that you're pulling hard enough. Folks, take a look at this. This is how his collarbone, we're literally maxed out in what we can do here. Maxed out. Take that. All right, hold this, Luis. I'm going to pull the shoulders myself. Hold this.
Yes, sir.
Right there.
Yep.
Don't let it come out.
Nope.
It may want to back out. Don't let it back out.
Yes,
Let's see what we got. Shot. All right, that looks pretty damn good. This is a real stretch. We're taking this procedure literally to the limit of what we can do. And it's not just the endoscopic, guys. If this was an ACDF, we would be at the limit. Because this is really tough. I can see we're at the right place. 2, 3, 4, 5, 6, 7. The problem is his collarbone is so high, it's really pushing against us. But I can see that we're at the back of the disc where we need to be. All right, relax. I need the tube. Whether we do a open surgery or an endoscopic, you could see this is a maxed out procedure. There's literally no room here. I don't think an ACDF would even be possible because his neck looks long. Like it's very deceptive. When you look at him, he's tall, he's 6'2", his neck is long. He looks like he'd be perfect for being able to do any surgery through the front. But the reality is that his collarbone is so high, it's blocking access to 6-7. Now 6-7 is typically easy to access. Go ahead and give both shoulders, give me the neck. Shot. I felt things move that time. Shot. I need to see a little more. There we go. That's what I need to see. Shot. That's as good as I'm going to get it. And is it good enough? I don't know. That's it. That's it.
Okay?
Yeah. That I can't do better than that, but I don't know if it's good enough. I'll be honest. It's just hard to say. Yeah. We'll see. I hate to sound so cliche, but it is in God's hands. Each and every one of our cases. I'll be honest, I don't like it, but it's the best that can be done, and I'm going to go for it while we're here. I just have to be careful with the amount of time on his skin, because it's under pressure. I just worry about having some type of a breakdown. Let's go, quickly. Come on. Thank you. Let's see what we can see. We didn't really get to do a discogram, so we're not going to have the benefit of our discogram stuff, the blue stuff that we typically have. To me, it looks like disc. Unfortunately, there's a little bit of blood because it's degenerated so bad. Man, it is a bit blurry, huh? Yeah, I'm just getting this laser to be available on time. I don't know, is that you or him? Huh? Why it's not ready sooner? Right, all right. That's fine. Just why am I getting popping? Is it? I don't feel anything on the laser fiber. It looks pretty good.
Irrigation is fine. Irrigation is fine?
Damn.
Okay, good.
Well, we're definitely where we need to be. It's just almost impossible to move my tools because his shoulder and chest are just blocking me from being able to do this. And I am not happy right now with the visibility that we're getting. I don't know why. Do you know, Luis? Huh?
When I did the white balance, that's pretty nice.
Yeah.
Now it's here.
You have another cervical scope?
Yeah, so
I could try. Why is the bag sucking so much? Part of the problem is I can't move this as much as I want to.
additionally, please. Yeah, please, thank you. Lights on, please, thank you. That yellow, right?
I can't get anything.
Scope on, please.
We're right in the sternal notch, literally. Sitting inside the sternal notch.
Scope on, please.
That's how, look at the angle. Incredible. The optics appear good there, right?
Yeah. Well, when I did
Don't open it yet, guys. Just where's my pedal? Damn it. You guys gotta have my pedal. That's disc material. It's just, yeah, let's get that other scope.
can you open
Let's
it,
see if that
please?
makes a
Thank you.
difference.
Open it, Jonah, please. Thank you.
Why is the laser fiber not moving? So I'm starting to remove the herniation, but the problem is I'm not, because of his chest bone, his clavicle, and the angle of this disc, I am not able to get, right now I'm not able to get to where I need to be. Help me here
Yes.
with the chest.
Yeah.
We're literally having to push his chest down so I could move my tools around and do this surgery.
We have the
Do you
scope
have
already.
the next scope? Let's
Lights
try
on,
it.
please. Lights on, please. Thank you.
Mm-hmm. Scope off. We're going to switch the scope, see if that makes it any better. That's great.
All right. Lights off. Thank you.
I have a feeling we're going to be stuck with this. Doesn't seem to matter.
About changing the date too. So
It's still not
still not
very
working,
good. Yeah. I just don't think it's going to be able to do what we need it to do. That's the problem. Well, we did the best we could. Yeah, unfortunately, I just cannot get it moving properly, and I don't want to jeopardize the safety of the
Lights
patient.
on, please.
So we've done, no, grasper's not going to work, unfortunately. Yep. Yeah, turn it off. Yeah, we're not going to be able to complete it, unfortunately. I've done everything I can do.
Only one irrigation. And then, no, okay.
So, yeah, unfortunately, we're severely limited by his anatomy. Normally, we're able to get the bottom disc C6-C7, sometimes even C7-T1.
If you have all the information,
But
turn off.
here you go.
Thank you. Thank you.
But we're not able to do that. And the reason is simple. We're literally, this is the collarbone right here. You can see this, right? On both sides. And we're pressed up against the sternal notch. And I cannot get this thing moving because it's just trapped.
Do we have study strips already? Yes, sir. Yes, you can.
So I can't do a complete surgery. Unfortunately. Not happy about that. But we did the best we could. It was very close. Problem is, I don't even know if a fusion would work because it's so low up against the collarbone. Watch this stuff. Well, unfortunately, I don't feel good about that. We weren't able to get all the herniation out. We were only able to get a tiny bit. And I just couldn't. It's impossible because of his anatomy. And there's no way to know that until you get in the operating room, unfortunately. So, disappointment. But I think the patient's safe. All right, we can go ahead and just end the broadcast.